there, I'm Caitlin. I'm also known as Mother Down Under. I am a registered nurse and a childbirth and postpartum educator based in Brisbane, Australia. Today, I'm going to be talking about what to expect after birth. So, hot tip, that immediate postpartum period is literally blood, sweat, and tears. So, I always say postpartum is a very human time. Like I said, blood, sweat, tears, aches, pains, feeling awkward in our own bodies. And most of us, we're not really comfortable with the very human aspects of our bodies. And so dealing with that and kind of dealing with our own humanity can make postpartum even more challenging than it already is. But as with most things, I think that being educated and being prepared is key. And just like it's really important to go into birth with an understanding of what your body is going to be doing during birth, it's also really important to understand what your body is going to be doing throughout postpartum. Because just like during birth, throughout postpartum, your body is going to be doing a lot. So let's look at what to expect after birth. And again, this is what to expect physically of your body. There's also a huge emotional component to postpartum, but for now, we're going to stick to the physical. So, number one is lochia. So, lochia is vaginal discharge. It's made up of blood, mucus, uterine lining. It will be quite heavy at first, immediately after birth, but it will subside to a lighter flow. So whether you've had a vaginal birth or a cesarean birth, you will pass lochia for about 6 weeks after birth. If you have noticed that it's been getting lighter, the bleeding has been getting lighter, but then it starts to get heavy again, that can be a sign that you're doing too much. So it's this signal from your body that it's too much, it's too soon, and what your body's asking you to do is to slow down and to rest. Number two, night sweats. So the night sweats in postpartum are wild. They're caused by really intense hormonal shifts, and it's also just your body getting rid of excess fluid. They should only last for a week or two. During that time, it might be helpful to sleep on a towel. Otherwise, you're just going to be wanting to change your sheets every day. And in postpartum, nobody has time to change sheets every day. So sleeping on a towel, like I said, that can help. Or if you are having visitors who are coming to support you in that immediate postpartum, you can ask your visitors to change and launder your sheets for you. But yes, be prepared for those night sweats. Number three, tears. Most women experience mood swings, feeling overwhelmed, extreme teariness in those early days. Sometimes this is referred to as the baby blues, and this is thought to be caused by changing hormones, but certainly sleep deprivation and your birth experience, those can play a role as well. If you are feeling blue and you want to get a nice hit of happy hormones, snuggling your baby, having really good skin to skin with your baby, that will get your oxytocin flowing. And oxytocin is one of our happy, feel good hormones. So when in doubt, skin to skin, snuggle your baby. Number four, after pains. So you will continue to have contractions after birth. So again, it doesn't matter if you've had vaginal birth or cesarean. After pregnancy and birth, your uterus needs to go back down to its normal size. It needs to go back down to its normal place, and it does that by contracting. So these after pains, usually they will be experienced when you are breastfeeding, or pumping for your baby. And that is because when we're breastfeeding or pumping, we're releasing oxytocin. Oxytocin is the hormone that directs our uterus to contract. So you'll feel those after pains, like I said, when you're breastfeeding or pumping. If you're finding that the after pains are quite uncomfortable, you can use breathing to make them more comfortable. So if you've done any breath work, or if you did any breath work in labor, you can use that same breath work to sort of ease the sensation of the after pains in postpartum. Also, heat packs can be really effective. Number five, some other surprises. You might experience constipation. You might have to do some wound care if you had a more significant tear or episiotomy or cesarean section. Engorged breast, sore nipples, those are both really common as well. So, all of this physical work that your body's doing, this is why the postpartum period is often referred to as the fourth trimester. So, even though you are no longer pregnant, your body is still doing a lot of work. It is doing the work of recovering from pregnancy, recovering from birth, and it's also doing the work of transitioning to motherhood. So it is really important to honor all the work that your body has done and the work that your body is doing. And the best way to honor this work is by resting. So allowing yourself that time and space to recover and to heal and to rebuild. You deserve it. Like I said, you've done the work. You've done the pregnancy. You have given birth. You are now figuring out how to feed your baby. You are becoming a mother. There is a lot happening, so you deserve it in the moment. And also, your future self will really thank you if you take that time out and really focus on rest in your immediate postpartum. So I know this was really short and sweet. I've also only focused on the physical. Like I said, there is this really big emotional side to postpartum as well. So if you want to learn more about the physical, about the emotional, about your baby, about feeding, sleeping, if you just generally want to get ready for life after birth, then my online course, the Positive Postpartum Program, is for you. It will get you feeling really prepared and feeling excited for everything that is to come. So I hope this has been helpful. If you have any questions, please leave them in the comments. I am very happy to help.